On Dr. Mahmoud on the risk level.
Thanks. Bear with me, I will explain, because this is an overall risk assessment. When we do a risk assessment, we answer 3 questions. 1, the potential risk for human health. 2, risk of an event is spreading. 3rd is the capacity available. And then from there, we look what's the likelihood and the consequence. From there, we assess. Looking right now, what clearly changed from when we did the initial risk assessment is the risk of event spreading has gone from a moderate to high, and the risk has gone very high. We have seen now evidence in South Kivu, Mitumaharisa, in Goma, in all the places, in the 2 imported cases. So the potential of this virus is spreading rapidly is high, very high. And that changed the whole dynamic. Linked to that is the capacity to respond to this outbreak. Insufficient control. DG was very clear that you was in a humanitarian situation. So when you combine these 2, the risk shift from high to very high in Eastern DRC.
Over to Dr. Tedros.
Thank you, Christian. Good afternoon to everyone in the room, and good morning, good afternoon, and good evening to those joining us online. The Ebola outbreak in the Democratic Republic of the Congo is spreading rapidly. Previously, WHO assessed the risk as high at the national and regional levels and low at global levels. We're now revising our risk assessment to very high at the national level, high at the regional level, and low at global level. So far, 82 cases have been confirmed in DRC, with 7 confirmed deaths. But we know the epidemic in DRC is much larger. There are now almost 750 suspected cases and 177 suspected deaths. The situation in Uganda is stable, with 2 cases confirmed in people who traveled from DRC, with 1 death. The measures taken in Uganda, including intense contact tracing and cancelling the Martyrs' Day commemoration, appear to have been effective in preventing the further spread of the virus. An American national who was working in DRC has also been confirmed positive and transferred to Germany for care. We're also aware of reports today about another American national who is the high-risk contact who has been transferred to the Czech Republic. The governments of DRC and Uganda are leading the response with support from WHO and partners. In addition to our national staff in DRC, so far we have deployed 22 international staff to the field, including some of our most experienced people. And we have released $3.9 million from the contingency fund for emergencies. We're also in touch with UN humanitarian chief Tom Fletcher, and I thank him for allocating $60 million to the response. On the ground, we're supporting national authorities with every pillar of the response, including contact tracing, establishing treatment centers, risk communication, and community engagement, and more. Together with the Africa CDC, WHO is also establishing a continental incident management support team.
And there's the urgent need required in solidarity and in support of that, rather than travel restriction and ban. We need humanitarian access. We need flight to go there. We need to stand with the local authority and all the NGOs working there. Is the time for solidarity. So the slightly change is because of what we are seeing, the epidemiology-driven data. But if we implement all the containment activity, the contact tracing, the building the trust with the community, expanding the lab, our representative already indicated what we are doing there, we will be able to this and reduce the risk from very high to high and hopefully moderate. But it requires global solidarity.
Health officials are warning that the Ebola outbreak in Eastern Democratic Republic of the Congo has entered a far more dangerous phase, with the overall risk level now classified as very high. During a briefing, Dr. Mahmoud explained that health experts assess outbreaks by examining three major factors: the threat to human health, the likelihood of the disease spreading, and the ability of local authorities to contain the crisis. According to officials, all three indicators are now raising alarm. The most significant change is the growing evidence that the virus is spreading beyond its original area. Investigators have identified cases appearing in multiple locations, including imported infections linked to movement between regions. Officials say this demonstrates the virus has the potential to spread rapidly if aggressive containment measures are not maintained.